Are you enjoying a return to normalcy? Like I say, it's the first time I went on a vacation outside of Canada with my family in years. I still can't go to the United States because I'm unjabbed. But I feel like things are getting back to normal. Like I see the odd person with masks, and I see the odd person with those sort of beekeeper or sort of welders, like a glass visor or plastic visor, and I sort of feel sad for them. I feel like they're got a little bit of what's that called, Munchausen syndrome, where they're not very interesting people. They maybe don't have that much of a personality, so this is their shtick. It was their identity. They loved the COVID crisis because it gave them meaning, and they knew what the rules were, and they could be great at following the rules. And they sort of miss that. They don't like the freedom and choice and chaos of real life. But if you think you're out free and clear, the world's creepiest billionaire has another thought for you. Here's Bill Gates saying, get ready for the next pandemic. He's excited. Take a look.
Why and how ready should we be for the next pandemic?
Well, governments are there to protect us. And so, they have us practice for earthquakes. They have a fire department with lots of full-time people to stop fires. They have armies that are there to deal with wars. But the pandemic is a disaster that they didn't prepare for. The actual resources required to have a global surveillance team, to make better diagnostic technologies, to do quick detection, it's actually not going to be that expensive once the world gets organized and makes it a priority.
So active preparedness for the next pandemic, because as you've said, it's not a matter of if, but when. How do we actively prepare? And are you seeing anywhere in the world where there's actual preparedness for a future pandemic right now?
Well, there's some good innovation. The idea of improving the vaccines so that they block getting infection, making them so they last a long, long time. Being able to make very cheap diagnostics that you could literally produce billions of very quickly. So the innovation side, I think, is starting to move. But picking how we strengthen WHO, create a special organization dedicated to pandemics, how we staff that, how we get every country to practice. For fire, you've got fire drills, you've got signs. So we need a little bit of preparation so that we actually can stop something before it goes global. So we'll have lots of outbreaks, but we don't need to have pandemics.
Right.
There's so many things in there. His prescriptions are, well, maybe we can have a vaccine that blocks infection. Yeah, that used to be the definition of a vaccine, isn't it? Maybe it can last. Yeah, that used to be the definition of a vaccine, wasn't it? We need to strengthen the unelected, unaccountable, China-driven World Health Organization and have a special pandemic World Health Organization. Can you imagine? Absolutely a maniacal dictator. The role of the government is to protect us. I don't quite think that's the role of the government. I mean, I think having armies might be an answer. It might be true. But the government did not protect us from the pandemic. They didn't stop it from coming here. You can't stop a pandemic in our modern age. They didn't minimize death. In fact, in the case of New York in particular, and in Ontario, they sent COVID-infected seniors into long-term care facilities. They actually put at-risk people, well, not to find a point on it, they killed them. Governor Cuomo in New York was the worst at that. The public health theater didn't help anybody. Like I said earlier, the kids were at the lowest risk, yet they were the most punished. Incredible clip. I don't know if you can find it quickly, but the former head of the sorry, not the FCC. I got all my acronyms mixed up here. the former head of a public health commission in the U.S., whose acronym I've just forgotten right now, Scott Gottlieb, said no one actually knows where the 6 foot of separation rule came from. Remember that? He was the head of the FDA. Sorry, I was getting confused. I knew it wasn't the head of the CDC. Scott Gottlieb was, nobody knows the origins of a 6 foot social distancing recommendation. That's Scott Gottlieb. I think he's on the board of Pfizer now. He admitted, no one knows where that came from, but that became the law